I am Miftahul Barbaruah, OIE VPP consultant. The OIE assigned my colleague Dr. Neen and me to design and analyze the pre-meeting workforce survey. It was a team effort that involved several OIE officials and consultants. At the outset, I would like to express my sincere thanks to the survey participants and all the contributing team members. Before discussing the findings, let us look into an analysis of workforce strengths based on the available WAHIS data of 17 countries out of the 22 that participated in the current survey. Based on the WAHIS format, the workforce of animal health amongst the select 17 participating countries generally comprises of veterinarians, veterinary paraprofessionals, and community animal health workers. If we look into the workforce structure in animal health, 32% personnel are veterinarian, and VPP and community animal health worker comprises 51 and 17% respectively. The ratio of veterinary paraprofessional to veterinarian is 8:5. Further, the analysis indicated that the majority, 64% of veterinarians are working as public veterinarian in animal health. Very limited veterinarians are involved in public health, and again only 21% of veterinarians with animal health functions are working in private sector. Beyond the WAHIS data, if we look into analysis of the OIE 2018 survey of Asia and Pacific, the work area of veterinarians are mostly companion animals and government administrative work. There is provision for reporting community animal health worker to WAHIS, and analysis of data of 17 select participating countries indicated that 7 countries had reported community animal health worker, and their number varies from 512 to 14,000 in these countries. Following the discussion on workforce strengths, let us review the findings of the pre-meeting survey participated by the majority of target countries of this workshop. The slide gives you a glance at the participating countries of the current pre-meeting survey. Out of the 23 targeted countries of Asia and Pacific, we receive a response from 22 countries. The majority of countries represents from Southeast Asia, followed by South Asia and the Pacific. To understand the workforce situation within the region, we wanted to know the participants' view concerning some given possible cases. It is interesting to note that as high as 73%, 16 out of 22 participating countries, indicated a general shortage of personnel in veterinary services. More participants from Southeast Asia opted for this situation than participants from South Asia. A few noted observation includes that 41%, that is 9 out of 22 participating countries, reported that personnel is doing non-veterinary jobs. The same percent of countries also mention high retirement and fewer new hires. You will agree on the importance of timely promotion of personnel and recruitment of new people. Another interesting observation is that up to 30%, 7 out of 22 cases, young peoples are not opting for veterinary as a career choice. Mostly the respondents from South Asia have mentioned inadequate interest of young people to join the profession. The analysis points out that situations vary from country to country. We must keep reviewing factors that can influence the country's workforce availability. The survey finding indicates 41% of countries regularly review their human resource need within the veterinary workforce, such as number of veterinarians or veterinary paraprofessionals needed to prepare against any shortage. For Southeast Asian countries, this is 44%, and for South Asia, this is 43%. One of the goals of this workshop is to encourage countries to review their human resource needs regularly. We all know that besides workforce number, the distribution and composition of workforce are also essential aspects. The current workshop is likely to help us review the needs more systematically and ensure required actions. While discussing the workforce situation, we observed that 7 out of the 22 countries have reported that young people are not interested in joining veterinary profession. In this analysis, we wanted to know if countries target young people to meet the workforce needs. We asked if countries offer scholarships or subsidies to study or conduct any school awareness program to attract young people to join the veterinary workforce. It is encouraging that 55% of countries are encouraging young people to join the profession. This is 67% in case of Southeast Asian countries and 50% in case of South Asia. In this analysis, we explored if country governments are opting for contracting of private veterinarians and veterinary paraprofessionals to carry out work that is usually the responsibility of public veterinarians and veterinary paraprofessionals. 9 out of the 22 countries, that is 41% respondents, are considering this option as a way to meet the workforce needs in public sector. At 44%, contracting is more preferred amongst countries in Southeast Asia. During the survey, we asked few specific questions related to veterinary paraprofessionals, and in this section, I will highlight the findings specific to veterinary paraprofessionals. Before we go into detailed analysis, let's look into the official definition of veterinary paraprofessionals as per the Terrestrial Animal Health Code 2019. It indicates that veterinary paraprofessional receives training only for the designated task assigned to them by the country veterinary statutory body. The second definition is not official, but we use this mainly for current survey to accommodate country situation when there is no veterinary statutory body, and primarily to differentiate between the veterinary paraprofessionals and community animal health workers. The veterinary paraprofessional gets at least 1 year of formal training. As indicated in the previous slides, the survey is focused on veterinary paraprofessionals. However, we need to understand that community animal health workers participate in animal health provision in 63% of the participating countries. They are contributing in 78% of countries in Southeast Asia and 50% in case of South Asia. There is a scope of exploring to help community animal health workers graduate as veterinary paraprofessionals with more appropriate training. In the context of veterinary paraprofessionals, we wanted to understand if veterinary paraprofessionals have the legal enabling environment to sustain and grow with their services. The significant finding indicates that 64% cases, that is 14 out of the 22 countries, legally recognizes veterinary paraprofessionals in public sector, whereas 27%, 6 out of 22 countries, recognizes VPP for assistance in private sector. In 10 out of 22 countries, veterinary paraprofessionals requires to operate under the supervision of veterinarians. Interestingly, in 5 countries, that is 23% countries, legal framework allows registration of VPPs under veterinary statutory body. If we look closely into the presentation, the legal framework for training and continuing education of VPP is missing in most of the countries. In this presentation, we attempted a more detailed analysis of 65 responses from 22 countries to see respondents' preference vis-a-vis various legal enabling factors. It indicates again that top address enabling factor is recognition in public sector, and the least address enabling factor within the regions relates to veterinary paraprofessional training. In this presentation, when we look into findings related to institutions involved in recognizing VPP training, we see various stakeholders, including agencies related to skill and vocational sector, are also engaged in VPP training. A significant observation is that the role of veterinary statutory body for VPP training is still limited. Recognizing the importance of quality training of veterinary paraprofessional, OIE published both competency and curriculum guidelines for veterinary paraprofessionals during 2018 and 2019 respectively. We shall look more into the use of these resources during the current workshop. The survey wanted to have an understanding as to how these guidelines are being used by the countries, and it indicated that 64% of participating countries of this workshop are already using the OIE competency and curriculum guidelines, with 3 countries reporting in-depth use of the guidelines. It is important to note that the OIE recognizes the diversity of veterinary paraprofessional situation in various member countries, and the developed documents are therefore only guidelines. Continuing our analysis of survey questions related to veterinary paraprofessionals, this analysis shows various functions the veterinary paraprofessionals perform, and you will see that it's a mix of animal health, laboratory, and public health functions. Veterinary paraprofessionals are also active in animal husbandry and breeding related roles. 18 out of the 22 countries indicated that veterinary paraprofessional functions include animal disease control activities. Few countries opted for the other option and mentioned interesting functions like assistance in livestock trade. This slide refers to the finding of a 2018 survey of Asia and Pacific, indicating that veterinary paraprofessionals are mainly categorized based on the functions they perform. The current workshop will look into the importance of assessing the gap in service provision within a country and appropriate role definition of veterinary paraprofessionals thereof. This presentation analyzes a question where we ask the participants if their country government or donor organizations or NGOs or other programs support private veterinary paraprofessionals to be self-employed. Only 6 out of the 22 countries, or 27% of the countries, have programs that support the self-employment of veterinary paraprofessionals. This may have raised questions in your mind as to, can the promotion of self-employment be a solution for workforce needs? What are the pros and cons of promoting self-employment amongst veterinary paraprofessionals? An ideal workforce is a balanced and mixed workforce. In this section, we will look into the status of women in the veterinary workforce. Before analyzing gender-related questions in the current survey, let us quickly examine the OIE gender assessment of veterinary services in Southeast Asia conducted during December 2015. The survey indicated that women's participation in workforce is not equal to men's, and the situation is slightly better in private sector. Among the participating 7 countries of 2015 study, female veterinarians' participation in public service varies from 35% to 74%. For private sector, this varies from 21 to 70%. The participation of women in the workforce is likely to differ significantly amongst the countries. Each country needs to explore ways to address various factors specific to their country to ensure the appropriate participation of women in the workforce. An exciting dimension of 2015 survey was analyzing the women student participation in selected veterinary schools. As you see in this presentation, the percentage of women in veterinary schools in countries like Thailand reached 76% in 2011. Except the People's Democratic Republic of Laos, there are more women vet students than men in all other 6 countries. For the current survey of 22 participating target countries, we only included 2 gender-related questions to understand the growth and promotion of women to decision-making roles. This presentation shows that as high as 86% countries have observed increased women participation in veterinary services. Interestingly, for 27% countries, this growth is remarkable. The second question was to understand the actual empowerment status of women in veterinary services. It is encouraging that 50% of countries that participated in the survey informed that their government makes formal efforts to promote women in the veterinary workforce towards decision-making roles. In 2015 gender study that we discussed initially has indicated that women can equally contribute to veterinary profession. Countries need to give value to the mixed workforce, also help women to achieve work-life balance, ensure equal opportunity, and create an environment conducive for working in remote areas. Thank you for listening to this presentation.